Hi, I'm Dr. Laurel Shader. I'm a senior scientist at Silent Spring Institute. We're an independent nonprofit research organization dedicated to understanding links between everyday chemical exposures and health. We've been conducting public health research on Cape Cod since the mid-1990s. I'm here today to tell you about a study currently underway on Cape Cod called the Massachusetts PFAS and Your Health Study. Our study is part of a broader nationwide study that's being funded and coordinated by the Centers for Disease Control and Prevention, or CDC, and the Agency for Toxic Substances and Disease Registry, or ATSDR. This broader study includes communities in 7 states with a history of PFAS drinking water contamination. And I'll tell you a little bit more about what PFAS chemicals are in a minute. The overall goal for the study is to improve our understanding of how PFAS chemicals can harm our health. The Massachusetts PFAS and Your Health Study is located in 2 communities in eastern Massachusetts. In phase 1, we're focusing on Hyannis in the town of Barnstable. In the second phase of the study, we're focusing on the town of Ayer, west of Boston. Silent Spring Institute is leading the Massachusetts PFAS and Your Health Study. We're collaborating with researchers at the Harvard School of Public Health and Eastern Research Group. We're also partnering with Massachusetts Breast Cancer Coalition and People of Ayer concerned about the environment. Our overall goal is to recruit 1,000 adults and 300 children across our 2 communities, and we estimate that about 2/3 of our participants will come from Hyannis. Enrollment for the study began in fall of 2021 and is currently underway. Why is this study so important? The Massachusetts PFAS and Your Health Study is contributing to a major public health study taking place in states all across the US. This study will fill gaps in our understanding of all the different ways that PFAS chemicals can harm our health, and will provide new information about the harmful effects of mixtures of different PFAS chemicals. Ultimately, we hope that the results of this study will inform future drinking water standards and other regulations to better protect public health. So what are PFAS? PFAS stands for per and polyfluoroalkyl substances. It's a class of over 9,000 different chemical compounds. PFAS have been called forever chemicals because they're extremely persistent in the environment and in our bodies, which means that they simply don't break down. They're also very mobile in the environment. They've even been found in the blood of polar bears in the Arctic, far from where these chemicals are used or manufactured. PFAS have been widely used in consumer products since the 1950s. They're present in nonstick cookware, waterproof jackets, stain-resistant carpets and upholstery, grease-proof food packaging, and many other types of products. Although they've been in use for decades, it's only been in the past 5 to 10 years when they've been recognized as a public health and environmental concern. And this is due in large part to their widespread discovery in drinking water supplies just in the past 5 to 10 years. Exposures to PFAS are widespread. Testing by the Centers for Disease Control and Prevention has found that over 99% of Americans have PFAS chemicals in our bodies. This is concerning because exposures to PFAS have been linked to many types of health effects. These range from elevated cholesterol and thyroid disruption to decreased antibody response in routine vaccinations and cancer. PFAS have been found in drinking water supplies all across the US, and Cape Cod is no exception. In particular, Hyannis used to have higher levels of PFAS chemicals than any other public water supply in Massachusetts. This is according to testing that was conducted between 2013 and 2015. Fortunately, the Hyannis water system has acted on this information and has installed extensive carbon filtration systems to remove PFAS from the water. You can see here in the picture the Hyannis water superintendent standing in front of 20-ton carbon filters that are filtering out PFAS from Hyannis water. It's important to know that Hyannis drinking water now meets the strict Massachusetts drinking water standard that was put into place in late 2020. Although the water is now being treated, it's important that we learn from past exposures so that we can make sure that future drinking water standards are better protecting people's health. So who's eligible to take part in the Massachusetts PFAS in Your Health study? We're enrolling adults and children ages 4 to 17 who lived in Hyannis anytime between May 2006 and July 2016. Children may also be eligible if their mothers lived in Hyannis during that period of time prior to the child's birth. Unfortunately, we know that PFAS chemicals can be passed along during pregnancy and through breastfeeding. Multiple members of the same household are welcome to sign up for the study, and you don't have to live in Hyannis now in order to be eligible. Because the study is focusing on exposures from drinking water, firefighters, and other people who may be highly exposed to PFAS chemicals through their job are not eligible to take part. We've set up a field clinic at 171 Main Street, just outside of downtown Hyannis, for our study. We follow extensive COVID-19 precautions to keep our staff and participants safe, and we offer Spanish and Portuguese interpretation services. So if you take part in our study, what will we ask you to do? One component of the study is an office visit where you'll come to our clinic at 171 Main Street. We'll collect a sample of blood and urine, and we'll conduct a series of routine body measurements, such as height, weight, and blood pressure. A second part of the study is to complete a questionnaire, which we'll do by phone at a time that's convenient for you. We'll ask you questions about where you've lived and worked over time. We'll ask you questions about your water consumption patterns. And we also have a series of health history questions. We've added some related to COVID-19 symptoms. Finally, for children, we're also conducting a series of neurobehavioral tests. These are activities designed to assess learning, memory, and attention. Well, what are we testing for? Samples from all of our participants will be tested for 12 different PFAS chemicals. This will provide an indication about the amount of exposure each individual participant has experienced. We're also testing for markers of health, such as cholesterol, blood sugar, thyroid hormone levels, and antibodies. For some of our participants, we'll be able to do additional testing. These include tests of total PFAS using a total fluorine method. We're also looking for changes in regular cell processes in people that have higher levels of PFAS exposure using a technique called metabolomics. We'll also be able to test COVID-19 antibody levels in participants who've had COVID-19 vaccination. So what will you get for being in our study? You'll receive a report that will tell you about the levels of PFAS chemicals in your blood. You'll also receive the results of the lab tests that you can share with your doctor. Adults who take part in the study will receive up to $50 in gift cards for completing all parts of the study, and children can receive $75 for taking part in all components of the study. Finally, you can have the satisfaction of knowing that you're supporting a major public health study. We really can't do this work without you. To learn more and to contact our study team, visit our website at bit.ly/ma-PFAS. You can call or text us at 508-296-4298 or send us an email. And if you live in Hyannis, you've likely received a postcard in the mail telling you more about the study. I also wanted to let you know about a second study that Silent Spring Institute currently has underway in Hyannis. This study is called PFAS Reach and is specifically focusing on how PFAS can affect immune system function in children ages 3 to 8. We're looking for children in this age range whose mothers lived or worked in Hyannis prior to 2016. Children may be eligible to take part in both studies, and you can learn more about the study on our website at the pfasexchange.org/children's study. Doing a major public health study like this requires many people to help us out, so we need everyone's help. If you're eligible, we urge you to consider signing up for the study. Even if you're not, we hope that you'll share information with your friends and family who may be interested in participating. We would welcome opportunities to give a presentation for your school, workplace, or house of worship. You can display a yard sign to help improve the visibility of our study in the community. And we'd love to hear your ideas for how we can best reach everyone in the community. Thank you very much for tuning in and learning about the Massachusetts PFAS and Your Health study.